As Wajeer County to have our First Lady as our guest of honor. She's always with us on any matters relating to mothers and children. Today, on this day, we are celebrating 25 children who have turned HIV negative because of our intervention. So, as Wajeer County, we have the lowest HIV prevalence rate that stands at 0.2% in the country. So we are number 47 out of number 47 in terms of HIV prevalence rate. But we are also among the only county that has not an increase in new HIV infection. Yes, our prevalence rate is low, it is 0.2%, but there are people who are being infected on daily basis. For example, in the year 2023, we had 82 persons who are infected with HIV/AIDS. So every day in our register, in our facility, we are seeing number of cases who are infected. And these are among the youth, the age of 25 to 35 years, meaning that HIV infection is common among the youth, the young people. Some who are newly married, some who are not yet married. So between 25 to 35 years. As Wajeer County, our HIV testing rate has increased from 38% to 42%. And we are yet to reach the target of 75% by the year 2027. So what you have seen in the media circulating is that the transmission, the prevention of mother-to-child transmission, yes, I respect that whatever has been circulated, because the last almost for a couple of years, we have only one child who has been infected. So, but what is happening is that our mothers are not delivering at the hospital. Our mothers are not attending antenatal clinic. And when these data are being made, they just look at the registers and say that these mothers have not, we have not done proper prevention of mother to child. So I'm urging our mothers to seek antenatal care at the hospital, because that is the time you'll be able to know your status. If a mother is 4 months, at 4 months she's supposed to attend antenatal clinic. If she's being tested and she is found to be a HIV positive, she'll be able to use what we call ARVs. Those ARVs now will prevent a mother not to transmit infection to her child. So I'm urging everyone, the mothers, to be using the facilities. We have operationalized several facilities. We have a lot of nurses and healthcare workers in general. This year we have recruited around 240 healthcare workers. We have operationalized several facilities. All this is to ensure that mothers are delivering at the facilities and bringing services closer to people. We have also integrated outreach services for the hard-to-reach areas, because there are some places that don't have health facility because of the access. So the ones that don't have health facilities, we are reaching them through outreach services. In the outreach services, what is provided is integrated health services. A pregnant mother comes, antenatal profile is done, the blood level, HIV testing, and everything is done. So that is also as a county government that we have done, and this is aimed at ensuring that the services are closer to people. We are not testing HIV for only people who are living in town, but we are also doing the testing for people who are living far away in hard-to-reach areas, so that we have equity in our healthcare services. HIV, we have seen from the role play how it went, and we have understood the role play. We really appreciate the organizers of the role play because we have learned, and the people who are seated here have learned a lot. HIV, if once the person is infected with HIV, does not mean that that is the end of life. There are people who have lived with the virus for 20 years. Ni kweli, kuna mtu ameishi na hiyo virusi mwaka 20. Provided umejielewa, umejikubali, wewe unaishi na HIV, provided unachukua madawa, lakini kama huwezi kutumia dawa, inamaanisha kwamba unaweza kutumbukiza ukiwa mjamzito kwa mtoto.
That at national level, we are advocating and urging people to register for SHA, Social Health Authority or Taifa Care, so that ukiwa mgonjwa, or if you just want to know your HIV status, you should be treated in any government facility. If you are not yet registered, itakuwa ngumu kupata matibabu. So we are urging each and every one of you who is not yet registered, muende to the government facilities whenever they are across the county, so that you be assisted to register. This time, SHA is going to help so many households because each and everyone near 100% registration. Hata ukiwa na watoto wangapi, the entire family is catered for in that registration. Ili ukiwa mgonjwa, you will be treated. Na the list kwa wale wako na mapato ya chini zaidi ni 300, na ukisalipa 300 kwa mwezi, then almost all diseases will be treated. Hata kama uko na cancer, kama uko na any other disease, utapata matibabu. And that is why we are urging every one of us to register.
Inta HIV positive tahay daawayaal jira ilmaha marka dhashid sida lagaaga dhalina jirta sifa as cunugga kaaga qaadin cudurka. Markaan reer Wajeer waxaan ku leeyahay isbitaalka imaada. cudurka HIV cuduryaal ka xunaa jirta. alxamdulillah hadda waqtiga aan joogna HIV hadaa qaadatid daawadaada hadaa qaadatid wax kaagu amaraha waa arkaysaa maamada hadda imaanaysa gabadhii walaashay quraxda qabta u jeedin muwagtada qof cudur qaba markaan daawadaada hadaa qaadatid wax kaagu maraha cudurkan cudur weyn ma aha mar hadaa ogaadid inaa cudurka leedahay daawada hadaa qaadatid wax kaagu maraha ilmana waa dhali kartaa ilmihiis bishidna waxay noqonayeen HIV negative. So gabdhaha tafadal marka arkin gabar uur leh waa ina dhahdeen isbitaalka ku soo dhal oo isbitaalaha la keenay. Marka waxaan rabnaa insha Allah culimada iyo qaadida iyo religious leaders ku kulli oo Wajeer iyada oo discrimination misi stigma ay ahayn ويلي قبل هتاي كو إمادان لازم أرتم ما ديه كنت لازم وأنا أسوبي ميس قفا ديه كنت ملها لكن وحلوب بهني وأنا داس ولا ليه هي كعبل أنا إسكول سنين يا إسبتال كتاجي صوفين هذا إسكو أرجدنا وحكا هلاوة ملها because مر هذا داود قادت إن شاء الله وافحنا نيسا مركز أنا أنت سوق بحا ما يشهد ما شاء الله ما أنت أنول جوج يو المهذا وcongratulations أن ليه هاي مر لبات مر ستحات إن شاء الله إذا كان قبلها أنت لهلا كرتين لهلا وحي أتسوجي إذا كرتين أو إسبتالك إمادة دي كرتين سوجي إن شاء الله. شكرا.